Black Health and Social Services Hub. We are so happy to have you. Janelle, over to you. And after Janelle, Licadon Diaz, who is the Executive Director of LAMP Community Health Services, will give the welcome address to you. Janelle, then Licadon. Thank you.
Thank you, Angela, and good evening, everyone. Today I'm speaking to you from the region of Peel, and this is the traditional land and territory of the Anishinaabeg, the Huron-Wendat, the Ojibwe Chippewa peoples, the Métis, the Haudenosaunee, and the Mississaugas, who have directly descended from the Mississaugas of the Credit First Nation. And as a settler on this land, I want to acknowledge the privilege that I hold in being able to move and to live freely on this land. As I do so, I continually express my respect and gratitude to the Indigenous peoples of Turtle Island. Ontario is the site of many treaties and agreements, and this land continues to be home to diverse Indigenous communities. So by acknowledging this land, I commit to doing my part to honor the treaties and agreements, to peaceably share and care for this land. September 30th is National Day for Truth and Reconciliation. And so as we get closer to this date, I want to invite all of you to take the opportunity to consider what your commitment to reconciliation might be. I want to also acknowledge that many came to this land forcibly, notably through the transatlantic slave trade and other means of migration that were heavily influenced by colonization. And so in giving this land acknowledgement, I also want to honor the ancestors of African descent, my ancestors of African descent, as well as others who unwillingly made Canada their home. And as we talk about the Black Health and Social Service Hub, and as we work towards addressing the health inequities faced by Black communities, I really want to invite us to consider what it means to do this work in solidarity with Indigenous communities, not just in Peel, but beyond. Our liberation is bound up with one another's, and it is our responsibility to work together to achieve health equity for all. So thank you all for joining me in that land and ancestral acknowledgement, and I'll pass it to Kidon.
Great. Thank you, Janelle. Good evening, everyone. I have the pleasure of providing your welcome address this evening. I will keep it short and sweet because there's lots to get through this evening, and we're so glad to see everyone here. Last September, we all heard the exciting news that there would be a $25 million investment in Black health, specifically in the development of a Black health and social services hub in Peel. We've been hard at work over the past year, doing some of the groundwork to get things going. And some of these initial pieces have been heavy lifting, but we've had a fantastic team in place getting things started. We know that our communities thrive when the whole village is engaged in the work. And so we're really excited and eager to have everyone together tonight. It's been a long time in coming, and we're really happy to engage with you this evening on the work and to get your inputs, your insights, and also to share with you some of what's been happening over the past year. So looking forward to connecting with folks tonight. We are 64 strong on this meeting right now, with more people joining by the minute. So really pleased with seeing how many people are interested and committed to this work. And we're looking forward to working with you as we develop this hub. On behalf of the team that's been doing the planning in the background, as well as our health system partners at the provincial level, at our local levels, regional levels, and on behalf of the whole community, I wanted to just say welcome to everyone here, and we look forward to sharing with you this evening. Thanks for being here. I'll hand it back to Angela.
Thank you very much, Gadon. Thank you. Yes, we're all excited, aren't we? So it's my pleasure actually now to introduce to you my namesake, Angela Robertson, who is the Executive Director at Parkdale Queen West CHC, and one of the tri-chairs of the Black Health Plan Working Group. Angela is the Parkdale Queen West Community Health Center is a community-based health service organization serving Mid and West Toronto. Angela is dedicated to people and communities facing discrimination, poverty, and marginalization, and working to change those social conditions. As I mentioned, she is one of the tri-chairs of the Ontario Black Health Plan, along with Anna Greenberg and Dr. Kwon McKenzie. Angela is a founding member of Blockorama, which focuses on forging spaces for Black and other racialized to LGBTQ plus people and allies in Toronto's Pride. In response to the impact of COVID-19 pandemic on racialized and low-income population, Angela initiated and co-chaired a Black Health Equity Working Group of health sector experts, leaders, practitioners, and researchers concerned with improving the health and well-being of Black people. For her work, she was recognized by the Alliance with the Denise Brooks Equity Champion Award and the Pillar of the Pandemic Recognition Award from the University of Toronto's Dalla Lana School of Public Health. Please join with me in welcoming Angela to talk about how the hub fits with the Black Health Plan. Over to you, Angela.
So thank you, my namesake, Angela Carter. Lovely. I just always, as I enter conversations about our lives as Black people, always need to locate myself. So I am here as a daughter of an immigrant woman who came from Jamaica to Canada in the late 70s as part of the what was then called the domestic workers scheme. And I say that particularly here as part of my introduction because my mother, during her arrival and her struggles in finding and making a way in this country, could have benefited from a Black Health Hub. So I come with thankfulness that the hub is here for other women who have come behind. So as I said, it is really a pleasure for me to be here, bringing congratulatory greetings as a member of the Black community, and particularly in my role as one of the tri-chairs for the Provincial Black Health Plan table. What we are here to affirm and celebrate comes out of years of work, advocacy, and good troublemaking in response to the differential experiences we have as Black people in the healthcare system, the differential access issues that we have in getting access to health services, and the differential outcomes we have in our health conditions. Black populations in Ontario are at higher risk of chronic health conditions, chronic illnesses, such as diabetes. You know, where I come from, they call it a little sugar. Hypertension, where I come from, they call it high blood pressure, and other population-specific diseases such as sickle cell. We know that inequalities and anti-Black racism often increase unless there are policies, focused investment, and initiatives targeted to supporting Black populations. The Black Health Plan that I am paired with and that I'm here speaking on behalf of provides really a coherent plan outlining urgent and long-term priorities and community-informed actions to improve both health access, to improve outcomes and experiences for Black populations. And this plan is paired very much with the birth of this health hub, this Black Health Hub specifically. The Black Health Plan focuses really on 4 pillars of work. It focuses on access to primary care. It focuses on support around chronic disease management. It focuses on pediatric care, and it focuses on supports around mental health and addictions. The provincial plan has these four focuses with 3 pillars. And I'll tell you that we started working on actioning the plan even before we had a plan. And this began with the work around the pandemic and our urgent response to what we were seeing in Black communities, where we knew coming into COVID that Black populations would be differentially and much more harmfully impacted, and that we needed to be seized in creating actions and strategies that would address those inequalities. And so say, so done. We did see in the COVID pandemic, Black populations who were differentially and adversely impacted by higher rates of COVID, higher rates of COVID complications resulting in increased hospitalization and loss of lives. And hence the Black Health Plan, one of the pillars was then about equitable pandemic response for Black populations. The other focus of the plan is equitable systems recovery with a focus on Black populations. And this is where the Black Health Hub is twinned and pair, because we knew that having that experience in COVID is that coming out of COVID, we then needed to be seized by having particular targeted investments and strategies that would ensure that this thing that people were calling post-COVID recovery would mean recovery for Black populations equitably as well. So we have seen initiatives like the Black Health and Social Services Hub as one of those paired lifting up of action. The final pillar of the Black Health Plan is sustained health equity for Black populations. And this becomes really important for all of us because we have seen, I call it, fly by night, flash in the pan kind of initiatives where there's a hue and cry. We get some resources, we get some investments, they're time limited, they're shortlisted, but they're not long-term and sustained. So within this Black Health Plan, we have sustained health equity for Black populations because we really believe that successful strategies to ensure equitable care must be embedded. It must have the ability to be spread and scaled. And that in one case, and in all our cases, that I believe in this particular moment, Black people's business and our improved access to health and social care must be the system's core business, not a side project. I know I have 5 minutes, so I'm coming down to the end here. The Black Health and Social Services Hub aligns directly with Ontario's health and clinical focus work. And hence, it is important that we who are here continue to say thank you and congratulations to the folks who have made this space and this place possible. The historic initiative that is the Black Health and Social Services Hub represents, I believe, the Black Health Plan in action. This hub meets the needs of Black communities in Peel and surrounding areas and really set out to achieve improving both health access, health outcomes, and a range of connected services rooted in community, informed by community. The hub, I believe, will also pave a way as a model for what it means to provide culturally responsive care for Black populations. And we know we have a sister and partner, Taibu Community Health Center, on the other end of the city that we can certainly build and partner and learn from and grow with. So I say to you that in closing, that the health of Black people matters, and that it is our collective responsibility to improve the conditions for those who have experienced historical and contemporary injustices, and that the work of addressing inequality and anti-Black racism and righting those wrongs, that work is never done. And hence, we must be relentless in pursuing the strategies and all strategies that will bring improved health outcomes for Black populations. So I say congratulations to the Black Health and Social Services Hub for doing exactly that. Thank you deeply and congratulations.
Thank you. Thank you so much for that, Angela. And yes, the work is never done and the work must continue. And as you said, we must be relentless in our pursuit for the betterment of our communities. So thank you so much for that. And again, now it's my pleasure to introduce to you the executive team. We call them the executive committee. As you know, and they will tell you about the more about this. To develop the hub, we have three partners. We know we can't do it all alone. We know that we need to build capacity. We know we need to be able to work together because this is a unique initiative that we are building here. And we needed partnership. We needed to bring people together to be able to deliver primary care, mental health and addictions, and social services together for our community. So I'm really pleased to introduce to you the leaders of the three partner agencies that are working to deliver this integrated service to our community. So we have Cadone Diaz. You met Cadone, who gave the welcome address, and now I'll read more about her bio. So it's Cadone David Smith and Shane Joseph. So Cadone Diaz's commitment to building communities has fueled her passion to work in the not-for-profit sector for over 20 years. In her current role as Executive Director of LAMP Community Health Center, Cadone leads a multidisciplinary team in the delivery of primary health care services and health promotion programs that address the needs of the whole person, with special emphasis on areas including health equity, youth development, and education. Cadone has worked to improve access to the resources needed to help communities grow and thrive. David Smith is the CEO of the Canadian Mental Health Association, Peel Dufferin. Over the last 10 years, David has stewarded the growth of the organization. Under his leadership, the organization has also established a 24/7 crisis support Peel Dufferin program, implemented the Rapid Access Addiction Clinic, redesigned multidisciplinary teams, introduced Ontario Structured Psychotherapy, the Black Health and Social Services Hub, and is an active leader of the Hills of Headwater Ontario Health Teams and the co-chair of the Central West Ontario Health Teams. And Shane Joseph is the Chief Executive Officer of Roots Community Services, and a nonprofit organization that serves primarily the Black, African, and Caribbean communities in the regions of Peel, Halton, and Upper Grand, delivering social services and mental health programs to uplift and empower individuals. He is a social worker and psychotherapist with over 20 years of wisdom in the areas of masculinity, gender-based violence, program and policy development, suicide intervention, and mental health. And the three of them will talk to you now about what we've started to do, how we're doing so far, some of our successes to date, and probably a bit of look to the future. So over to David, Shane, and Cadone.
Next slide, please, Yvonne, and I believe Shane is going to get us started.
Thank you very much, Angela and Cadone, and good evening to everyone. As you have been hearing, the Black Health and Social Services Hub, and many of you might be asking, what is this? What does that mean? And how do we contextualize that for the region of Peel? I believe Angela Robinson has situated, grounded, and affirmed exactly what is the Black Health and Social Services Hub, which is a joint initiative that will provide, and I want to be very clear, Afrocentric programming and services in primary health care, mental health and addictions, and social services that will holistically address the needs of the Black, African, and Caribbean communities in the region of Peel. Next one. As we begin to look at the very thematic area that governs the model that we use, we remind you that this hub will be a 3B organization, or B3 organization. Black focused, which means that we will be delivering culturally safe and affirming programs and services that responds to the health and social service model and needs of the Black, African, Caribbean communities. Black-led, ensuring that the leadership at the different levels, that is staff, executive, and governance, is Black-led. And of course, Black serving. We prioritize the needs of the Black African Caribbean clients for services.
The commitment of the Black Health and Social Services Hub, we've spent a lot of time making sure that we get this as right as we can, but we're still learning. We want easy to access, inclusive and integrated health and social services for the well-being of Black African and Caribbean communities. The Hub is going to provide an integrated interdisciplinary team-based model to provide seamless, easy to navigate, accessible, and culturally affirming services to Black, African, and Caribbean communities in Peel. So far, we've been working on a lot of things. There's been lots of effort to try and pull together what is a very complex project. Some of the trickiest efforts have been around facilities as we try to find space for locations, a location of the Black Health and Social Services Hub. The target location initially was Brampton. When we looked around in Brampton, we couldn't find anything that quite worked perfectly at first. So we're now also looking in Mississauga, and there's some promising prospects that have so far been identified. And partners have been using space in the existing service delivery sites. So we have a lot of staff that are already in place, and they are providing services, but they're doing it through some of our existing places. This lack of space has sort of limited us to begin with, so it's probably our number one challenge, and I think right now one of the most hopeful things we're working on. And then we have a commitment to also find space in Brampton should the first space end up being in Mississauga. Around health and human resources, a lot of the recruitment is well underway, if not completed. I notice there's lots of folks that are already working for the Black Health and Social Services Hub on the call, which is great. And the space challenges have meant we can't go as far as we've wanted to in terms of recruitment because we don't have a place to put everybody once they're hired. But we're hoping that we'll solve that challenge soon and staff up very quickly.
Great. Thanks, David. On the service planning and delivery piece, we are really pleased to share that service planning has started. We started delivering services, ongoing delivery as of July 2024. And although we have been we've needed to be extremely creative in terms of the use of our existing spaces to offer services. We have approached this from a place of integration in terms of our planning, our intake processes, registration, all of those pieces. We want the clients coming into this service to be able to come in and access care seamlessly without worrying about which organization in the background is making it happen. And so from that perspective, just wanting to congratulate the team on getting service delivery started, and client feedback has been very positive so far. And I hope we'll be able to hear from at least one client this evening, a little later on. But we're really encouraged by the uptake and the experience so far with service delivery. And thank you to the service delivery team and to the planning team. On stakeholder engagement, this is one of our key stakeholder engagement initiatives so far. It's well underway. We have work that is being done right now to develop our integrated clinical implementation plan, which is a plan to bring together all the three pillars of this work in an integrated way, in a way where the services complement each other and are exactly what the community needs. And so there's some work starting around that. So there's been some engagement there. We have some focus group sessions coming up in October, and you'll hear a little bit more about that a little later on in the presentation. And of course, we've started recruitment for our Community Advisory Council, which is a group that will help us to guide the direction of this project and really to keep us honest, make sure that we're, meeting the needs of the community. So lots of work happening there, and we hope to have more engagement happening over the next little while. Next slide, please. So you've heard about what we've done so far. This slide is a bit of a depiction of where we are looking to go over the next little while. So you'll see the red dot that says you are here. That's where we are right now in terms of our planning and getting work started. You'll see that the service delivery launched in July. We are now working on the integrated service delivery plan that I just mentioned. We're looking to have a strategic plan pulled together by the end of this calendar year. And we are looking to secure space. Right now, we've got some promising prospects in Mississauga, as David mentioned, and are also exploring options in Brampton with a commitment to having a presence in Brampton. It's taking a little bit longer to actually find a suitable space there, but we do have that commitment to making sure that we've got a presence there. And so you'll see on this that we also are looking to get a mobile health unit that would help us to have presence in different parts of Peel. Peel is a large area, and so no matter where the hub is located, the physical hub, it will be out of the way for somebody in some part of Peel. And so we are looking to have a mobile health unit as part of our resources to be able to reach as many people as possible. So, and of course, looking to move into space in Brampton in fall of 2025, and the search is on. So that's a bit of a look at what's ahead of us that we wanted to share with you in this meeting. So you got to look at what's happened already and where we hope to be headed. And I hope this quick synopsis of the work that's happened has been helpful in understanding the journey so far.
Thank you, Cadone, David, and Shane. Thank you so much for that overview of where we are, where we came from, and where we are, and where we want to go and get to. So next, we're going to have a panel discussion. And before we get to the questions and answer from you, the audience here, what we wanted to do is let you hear a bit about what the actual work that we have been doing. And so we have 3 panelists, and that will be speaking today. We have some questions we're going to ask them. And so we have those 3 panelists that will provide you some insight into what we have actually been doing. And my computer keeps jumping around here on me right now. So we have Raquel Bremer, Lillian Hushy, and Janice Hemmerding that will be speaking to you today. So Raquel is, I think, our newest member so far to join. So Raquel is a newly appointed clinical director of the Black Health and Social Services Hub and has held senior leadership roles in community health care, hospital, and social service organizations across the Greater Toronto area for nearly a decade. She has been addressing issues of social justice, anti-oppression, anti-Black racism, and stigma, and their impact on access to healthcare among historically disenfranchised populations for over 25 years in Jamaica, Norway, and Canada. Lillian Hushy is a preventative care specialist and care navigator, and a recent graduate in a registered nurse position. As a registered nurse, fueled by a passion for health and making a meaningful difference in the lives of others. Throughout her educational journey and time at Roots CS, she's come to understand the importance of breaking down barriers in our community and equipping individuals with the resources they need to achieve and maintain optimal health. She wholeheartedly believes in the power of holistic, well-rounded care and is dedicated to enhancing the health of the Black, African, and Caribbean communities. Janice Hemmerding is the Program Manager of Black Health and Social Services Hub, multidisciplinary team. Janice brings a depth of unwavering mental health and addictions experience with over 15 years in community and hospital settings. Since joining CMHA Peel Dufferin, Janice is known for her collaborative approach and held a number of roles, including her most recent as a clinical lead, high priority community strategies. So what I'm going to do, we have some questions that we're going to ask the panelists, and they will tell you more. As I said, I hopefully that by the time they finish answering these questions, you have a better insight into what we're doing and what it means to our community. So first, just going to ask each of you to quickly say, really, what is your role in the hub? And, just one, 2 sentences. What exactly is your role in the hub? And I'll start with you, Janice.
Certainly. My name is Janice Hemerdy. I'm the program manager of the Mental Health and Addictions team. The Mental Health and Addictions team includes not only the multidisciplinary team, but also the ACT and EPI teams. In this role, some clients find a sense of validation and normalcy through the connection of someone who looks like them. This connection instills hope in their recovery in a supportive way, as mental health concerns in our community is oftentimes invalidated.
Thank you, Janice. Lillian?
Hi, everyone. So I am the care navigator for the hub. In my role, I make sure that I help people that want to access the hub navigate the services in a seamless way, while also letting them know all the services that we have to provide and the ways in which we can target exactly what they're looking for, and also optimize their health.
Thank you, Lillian. And Raquel?
Good evening, everyone. As the clinical director, I have the wonderful responsibility to lead a dedicated team of clinicians. So that includes family doctors, nurse practitioners, RNs, and we maintain effective and efficient daily operations. And we do so with making sure we have high quality service delivery, centering our core values that are respect, compassion, advocacy, equity, collaboration, and we center the health needs of the African Caribbean Black community in primary care.
Thank you. And staying with you, Raquel, I want to ask, what does it mean to you to work in the hub, which is a unique model within the province of Ontario? And why is it important to you that the hub be Black focused, Black serving, and Black led?
Well, personally, it means that I get to support the design and implementation of a world-class example of what it should look like in healthcare. We know that anti-Black racism exists and representation does matter. When you walk into such a facility and you can see someone who looks like you providing the care, there are many research projects that show that health outcomes for our community are actually improved when we address these issues, including racism. It means that the hub will be able to provide timely evidence-based health and social services under one roof, eventually, when we get our locations. And it means that diverse needs of the community are advanced and centered in everything that we do. We ensure that our clients have the ability to address multiple healthcare needs in one visit. Sometimes they feel rushed and they're not allowed to say, oh, my back is hurting, plus maybe I have a knee pain. You know, they can do that in these appointments. They get a little longer time to explain the issue. It means that we can share examples with other regions that this is the type of service delivery model that is important for our community because of the different challenges that exist for folks who are newcomers from African Caribbean communities, folks who are refugees. They need someone to help them navigate the healthcare system, because in Canada, there are many different models. Folks don't just show up at the emergency room. They can come to our hub instead, which allows them to be seen in a faster, more timely, effective way. So these are the reasons why I think it's important, and our unique approach is really critical, because our community, there are too many barriers and we need to make sure that we eliminate them, especially when it comes on to our health, which is our wealth.
Thank you, Raquel. And Lillian, the same question to you. I'll repeat it. What does it mean to you personally to work in the hub? This is a unique model within the provinces of Ontario. And why is it important to you that the hub be Black focused, Black servant, and Black led?
So working at the hub to me means improving equity and ease of access. As a new grad nurse, I've seen firsthand how hard it is for members of the BAC community to access services, to the point where by the time they present at the ER or present in an inpatient unit, it's too late. And at that point, it's like prevention is better than cure. But at that point, that individual is so distressed with everything that's going on. And when you hear the stories, I've had the privilege of going out to outreach with Roots. I've been on the front lines, so I interact with community members. When you hear the stories of how hard it is for people to just get a specialist to see them, to get a family doctor, to just get an appointment even, and the wait times that they have to endure, it's like they automatically feel like it's another burden on top of the illness. So working at the hub to me really means going out there and supporting clients and making sure that they're seen, they're heard, they're taken care of in ways that they can't even imagine. The hub is the first I have ever heard of in all my years of living in Canada. And I think it is a very, very different way of approaching health, especially for such a vulnerable population like the BAC community. So I really believe that it's important for it to be Black led, because it is going to target the barriers that we have to face. It is going to open up the door for health to be improved. It is going to allow our community members to access health more, because as we know, most of our community members, the healthcare system has really they've had a negative impact on them, so they turn away from that. And it's quite sad to see how one community can be so oppressed by the system while another one flourishes. So I think this hub is really going to set the tone and give the BAC community members the opportunity to take control of their health, to reach services that they never thought they could have reached in under one building. Social services, primary healthcare, mental health, because they're all intertwined when we talk about health. So we're also very focused on culturally responsive and appropriate health. So that's why it's important for me to work to be at the hub, and why I think it's important for it to be Black focused, because it targets, honestly, when you look at the bigger picture of the hub, it's targeting all the aspects that we need to target in order to promote and improve the health of the BAC community members.
Thank you, Lillian. And Janice, from your perspective, what does it mean to you?
Fantastic. Thank you so much, Angela. Oh, Lillian and Raquel, you guys have said it all. But it is so important being at the hub to be so sensitive to the clients who approach us, because we know that our community face so much stigma, right? It is seen as a weakness, folks should get over it. And of course, so many of those in our community, they don't want to disclose this because of discrimination. So here you are within our community. You're being supported by people who look like you, who speak your language, right? Who make you feel heard. We listen, and we offer a very unique approach to care at the hub. We talk a lot about culturally affirming. And what does that really look like? It means treating each other's culture and experience with respect and high regard, right? Additionally, it's the fact that it's so holistic. You come to the hub and you can move seamless through social services, primary care, and again, of course, mental health and addictions. We know that finding a family doctor is so problematic, especially now with the newcomers that are in Peel that are coming around. So to say, call our number, our 647 number, and you can be connected. And the other services that you may need may fall under the umbrella of social services. How can we help you with that, right? So it is a collaborative group of professionals, mental health and addictions professionals from various disciplines who work to deliver services that really address individuals' well-being, while ensuring that our approaches to care are informed by the clients and that it's effective in meeting their needs. It is so important that when folks are working with our mental health and addictions team, that they're heard. I can't say that more, that they're understood, that their experiences are validated, right? We use a team-based approach to allow for seamless transitions within social services, primary care, and mental health. So it's allowing for us to provide the right care at the right time for the right people, for folks who look like us, by us. Thank you.
Wow, thank you so much. Listening to the three of you, and I would want to be in this hub, for sure. So I love your passion, all of you. Another question then. So we know we've started service delivery. So what are you hearing from the clients themselves and the service users? What are you hearing so far? I will start with you, Janice.
Certainly. So thank you, Angela. What we're hearing, apart from it's about time, right? No waiting for service. What do you mean? Are you sure? Right? And then we're also hearing that I understand what my worker is talking about because they're using plain language. And then, of course, finally, somebody who gets it, right? It is just so rewarding when we see folks walk into our space and they see us. They look, we look like them. We don't have to worry about how we're pronouncing words or how they're pronouncing words because we get it. What? We get it, right? Take your time. We get it. But also, I just want to share that we're also hearing that more is needed, especially around housing. So we hear that. And we've got to validate that for the clients that we hear. But overall, we're hearing it's about time and no waiting for service for folks who look like me. Fabulous. So we're really excited about the hub and the services that we provide. So thank you so much for asking about how we're doing so far, Angela.
Yeah. Lillian, the same question to you. What are you hearing? I know you're out on the streets, so to say, that you're out there. So what are you hearing?
I'm hearing a lot of gratitude. I actually have a testimonial here written down, and I think this really made me, it really made me feel like, wow, like the work I'm doing, like this is like life-changing. And a member of the community had said the hub has really started giving me education about how to handle my hypertension. I didn't know there was so much I could do to be in control of my health. I'm now aware that medication isn't the only solution. And I think just hearing that for me was like such like a like it was such a good feel. Like I got goosebumps in a way, and it really just really reinforced the reason why I got into health in the first place, because I think a lot of people only equate health to the Western medicine aspect of health without taking in the holistic aspect, that other things go into health. There's other ways you can handle your health, and that you are in control of your own health. You can go to the doctor's office, yeah, sure, but when you're home, when you're on by yourself, there's so many ways to take control of your health and be just feel empowered. So a lot of people are feeling more empowered. I'm seeing a lot of people feeling the initiative to take control because now they have a resource they can turn to, whereas it was, oh, I'm going on Google and they're giving you a whole heap of things that are scaring you. Now there's a platform and a service that has professionals, that has information that is evidence-based, that has the resources to for you to access. So I'm hearing a lot of gratitude and a lot of empowerment, and it's really, really nice to hear.
Okay. Raquel, I know you're very new, but what have you heard so far?
All good things, all good things. And like Lillian said, a lot of folks, especially when they are introduced to this model, did not know that they could have so many services being offered to them for free. It doesn't matter if they have OHIP or not. So if they don't have, Ontario health coverage, or they're new to the country, they're refugees, or they're undocumented, meaning they have no papers, they can still access services at our hub for free. They're hearing that, they're grateful to see Black providers being, especially in the clinical spaces, because they don't get to see that very often. We don't have enough clinicians who identify as African Caribbean Black in our province, and I know There are many people on this call and outside of this call working on that. They are grateful to find a provider that can work at their pace and address multiple needs. We're able to see every client across the lifespan. So, women who are pregnant all the way up to seniors. So everything under the sun we can address. And right now at our site at LAMP, we're operating on a Saturday because of space. So the fact that we can have someone can see a doctor on a Saturday evening for free in Peel is unheard of, and they don't have to show up at the emergency room. So these are things that we are seeing, and we have someone who've accessed our services on the call. I received a testimonial from her. She's a caregiver of our very first primary care client, and I'd like to introduce her to speak on her own behalf about her own experience accessing primary care. If she's on the call, please unmute her, because we don't want to, make up stories. We want to hear it from the persons who've accessed the services. So if she's on the call, please go ahead with your own experience of our service.
Yeah, unmute yourself. Yes.
Is she with us?
Yes, go ahead.
I'm wondering if it's me.
You're
talking.
your brother?
Okay, it's my brother.
Yes.
Yeah.
Yes. Welcome.
Okay, so I was not the patient who attended that clinic. However, I got a call from Cadone, who was telling me about your wonderful program. And she said, if you know anyone who needs assistance through this route, you can tell them about it. And so I said, my brother. Now, my brother, he has been struggling with mental health for many, many, many years now. And that was one thing that led me to study mental health and addiction, just to understand how to talk to him, how to treat him, and all these things. Because with him, I can tell you, he thinks that he knows everything and he's more intelligent than anybody else. And so I've learned now how to deal with him. But he didn't want to go to a doctor because he can take care of himself and all these things. So I said, this one you have to go because you're going to see your own Black doctor. And so we went. We were the first one, and I like to make history. We were the first one. We went there, and I went in not knowing what I'm going into, but because I know Kadona, I know that it must be something good that she's telling me about. And then upon entering the building and I walked in, I met a very fine young lady who introduced herself to me, and I told her I was there to see the doctor. And the welcome that I got was really, really, really good. And they welcomed my brother wholeheartedly, treated him really good. He went to see the doctor, came out feeling good. And I'm saying, oh my God, I wonder if he said anything to the doctor. And, I went and he talked about seeing the doctor, and he got the requisition to do his blood test. I kept on reminding him. He went and he did it too. And they told him on his second visit that he should go get his blood work, not his blood work, his blood pressure done and record it. So the next visit, he can bring the written information that he got. And I was very surprised that he came to me and he said, I went to Shoppers and I got it and they wrote it down. I said, very good, excellent. This is the first he has been so excited to go see a doctor. But I went and I told some of my friends about the service there. And they too went there and they're only singing praises. And when they told me it's an holistic thing that they went there to access, it was unbelievable, because my girlfriend, she just came down from up north And she didn't have a doctor, and she went there, she saw the doctor, and she's, going through all her things with the doctor. And she said, they're even going to support me in getting a place. And I said, that is so nice. So I must commend you ladies for really, really championing this thing and working so well, because it's only good things I'm hearing about the program. And I really, really appreciate you guys, because I've never seen my brother followed through with things like this before. So I was invited to come and talk about my first visit. And I just want to tell you that I appreciate you all. And this is wonderful. So keep up the good work.
Thank you so much for that. It's a blessing for all of us. So I really, really appreciate that and your testimony. And for those on the call here, you're hearing what it's all about. And we're going to be doing much more of this. This is the hub. This is the heart of the hub for us. That personalized, holistic care that you would get. So thank you, thank you, thank you. So just one last question because we want to open it up to our audience here. One last question for you. We know that we talked about this, about the disproportionality, how Black African and Caribbean communities are disproportionately affected by many chronic diseases. So how does the hub respond to our community's needs and gets you touch on some of it, and that testimonial really did. So just wrap up some more what you may not have said before, but how can you talk a bit more about how we respond to the needs of our community using the story that we just heard? And I'll start with you, Lillian.
So we understand obviously that the social determinants of health really shape physical and mental health outcomes. And they, as a BSC community, we face a lot of systemic barriers that affects our physical and mental health outcomes. So the hub is ready to tackle anything. And we provide those wraparound services that ensures that people are not getting lost in the loop, because health affects. I was having a workshop this Thursday and Friday, and we're really talking about the fact that health affects every aspect of an individual: mind, body, spirit, all of it. So in the hub, we make sure that the service you're getting, we're making sure that if you need anything more down the line, we're there to give it to you. And our CEO Shane always says, as workers, we shouldn't say we don't know anything as staff. And that's something that's really been instilled in me, because even if I don't know something, the community that has been formed with the hub and the resources that we have at the hub, there's no way that a person is leaving the hub feeling helpless in other ways or feeling incomplete. So we're always there to make sure that we're uplifting and empowering and connecting individuals through the transition of care that they need to. Whereas if you go to a walk-in clinic, you can only speak on one thing, and then everything else is get put on the back burner to the next visit. At the hub, we're making sure that that holistic care is really being focused on, just to empower and really strive for a better, healthier life for people. So that is what really makes the hub so special. And the social services that we have, honestly, we're really just there to make sure that people know what we have to offer, and that there's endless opportunities for us to really work together and to get to a place of optimal living, which is what we want for all members of the BAC community.
Thank you. And Raquel, and then Janice, you can answer that. Just anything more that you did not speak about how we responding to the community. And then we want to hear from the audience about what their voices.
My heart is full right now. I just want to acknowledge again the testimonial of our sister who just spoke. This is why we're all here. This is what makes that motivates me to keep doing what we're doing. And we just heard how essential this is. Someone comes in for a physical ailment, and they get connected to our sister or organization for housing. They don't have to take a bus for another hour and go to the organization up the road in another region, part of the region. We know that our community is, disproportionately affected by things like sickle cell, diabetes, hypertension, and as Janice mentioned, the stigmatization when it comes on to any mental health issue. We frame folks, oh, they're mad, and you don't know how to deal with them, and you don't know what to do. But under one roof, we can ensure that we provide health promotion and education around different illnesses, normalize these things, and also ensure that they get connected to the appropriate care in a very timely manner and do the follow-up. We want to make sure that everything is also confidential, and privacy is very crucial to what we do. So in the work that we're doing, we make sure that our staff receive all the relevant training. We center humanity and dignity, respect, under the Ubuntu Afrocentric ideologies that affect our community. And we want to just make sure that they understand that we suffer from complex health needs. So the hub allows us to support them holistically through an interdisciplinary team. And so they don't have to waste time, money, or energy trying to figure things out on their own. We have folks like Lillian who can walk with them through the process one step at a time at their pace.
Thank you. Janice?
Similar to Lillian and Raquel, my heart is full. Even having the hub opening, having it conceptualized and come to fruition, we hear what the community is saying about stigma around mental health. We understand that it oftentimes causes our community members to not seek help until it's too late. But as a mental health and addiction focus, we want them to know that recovery is possible, that we need services from representatives of our community so that they can feel comfortable being served through the hub in a space where they feel safe and less judged. As a community, we have patiently waited for support from individuals who share our cultures. When we say that representation matters, oh my God, folks, please believe me, I truly mean it. And you yourself know that when you walk into a room with that presence and you see people who look like you ready to serve you, you walk a little straighter, right? From the moment of service, we ensure that you don't feel any judgment. Instead, we meet you where you are, so emotionally and physically. And what does that look like? We will meet you in the community. We will meet you in your home. We will meet you in our spaces. And when we speak, we use plain language that's easy to understand, right? And we're here to support your recovery every step of the way, offering culturally affirming, again, care for folks who look like us. We really appreciated being part of this town hall and for sharing with you what you could expect from services that are being provided by the hub. Please remember to call our 647-812-5226 numbers. And speaking from the mental health and addictions, we have a number of individuals who are supporting our clients. We've got our trauma counselor who would help you understand how trauma shows up in your life, right? So how do you reduce the harm and improve how you can cope with life? We have case management services. We have a social worker, a family worker. Again, I'm wrapping it up. Brief mental health counseling, right? Again, to help individuals so that they have immediate opportunity for therapeutic conversations within a short time frame. And of course, not forgetting our addiction supports for clients who can utilize like harm reductions or abstinence-based strategies. It is just so important that folks find these services and see it from individuals who look like them and are willing to support them unconditionally. So thank you so much for having us as part of the panel.
You are most welcome. So thank you so much for the panelists. You stay on because we have some questions, and this is we are going into the question period here. I see a couple of questions already in there. Also, there are going to be questions. The EC team, the executive committee, is going to also come back to answer questions. So we'll be fielding everybody, the panelists as well as the the executive will be fielding the questions. So we do have a couple here in the chat. So please put your questions in the chat if you can. The first one, so if a patient leaves and has questions about medication or something they were instructed to do and then need to clarify, is there a system in place to get in touch with or reach someone from the care team? You know, yeah, I know Kadon answered. So Kadon, do you want to come on and answer more, provide more details around that? Because I see that you answered in the chat, but we just want you to speak so that everyone can hear.
Sure, thank you. And I realized that these were going to be answered in the Q&A, so I stopped responding in the chat. But just wanted to say that, of course, sometimes we leave appointments and we need to get some, clarification after the fact. It's as easy as calling back the care team at whatever service you've been accessing to share your question, and they will connect you to the appropriate person who can answer that question. When it comes to questions about medication, of course, the most appropriate person would be the healthcare provider, the physician or the NP who had written the prescription. So we would try to connect folks to the right person to give them the answer that they're looking for. And alternately, connect you or give instructions around who else can be contacted. In some cases, the pharmacist, if it's a script that was written for medication, the pharmacist may also be able to answer a question. The key, though, that I mentioned here was that we are priding ourselves on responding in a timely way. So reaching out to someone in the clinic and posing that question is the best way to do that. And we will connect clients to the provider that's most appropriate to provide a response.
Thank you. And we do have the support line and the care navigators that will be able to help you. So if you come through online or if you come in person or so, we do have those, we have a team that will be here to support. Another question we have is, what role can Black organizations and residents play in ensuring the hub is fully implemented and sustained as envisioned? So I'm sure that is for one of the executive committee team. David, Shane, Kadon, who wants to take that one?
Maybe I'll go and answer that one. What I wanted to do at that point is that I would like to put this question, Angela, in the parking lot, because when I come back to do a little bit about the then to now, the answer to this question will be given with much more. So if the person who has asked this question could hold for a bit, I'm prepared to serve you everything that you need: appetizer, main course, dessert, and a little jolly bag to go home with. So if they can wait for a little bit, I'll be happy to answer that question. And it will be a call to action for not just the persons who are here, but for those who are going to tell others, as we heard from the client, pass the message on. And I think we would be upholding to some of the principles within the BAC community when we hear our elderly folks remind us of Sakitan, Palelos. Who yeah? Tell the rest. So in just a moment, I would share a little bit around what the response would be in that, and everyone else here would tell the others.
Okay. So we do have a suggestion, right? So I think you can speak to it too. Something needed in the mental health space is to have a step-by-step guide for family members concerned about loved ones on how to interact with police services should they need to call in a wellness check. Safety is of the utmost importance. So the person is recommending a mental health, a step-by-step guide for family members. Who would like to speak to that? David, would you like to speak to that, coming from the mental health perspective?
Yeah, honestly, it's a fantastic question. We have some materials that we use within our crisis programs and within the I guess our quick guide, which is an overall guide to mental health. But we haven't developed anything particularly for the Black community, and I think it's a great idea. So the first thing we're doing is getting services going and starting to get everything running and beginning to provide services. I would imagine maybe Janice can add to that, or Michelle, who's the director involved. But we're starting to think now about what are those materials that families need to go away with. So at the very least, you've put something on our to-do list, and I'm not sure if we've started to undertake that yet, but it's critical. And it's one of the main reasons why we got involved from CMHA Peel Dufferin, is because that's where a lot of our interactions in the past have been, and the outcomes are not as good as they should be. So we have a lot of experience working with the police, the good, bad, the ugly, and we can hopefully build something that we can pass along. But I don't know, Michelle or Janice, if you have anything to add to that.
Okay, I just got.
Could you
you want to
unmute
say something,
Michelle?
Janice?
Michelle is trying to say something. If you could unmute her.
Yeah. Yeah, I think some of the folks can't unmute themselves, right? Yeah.
Okay, I have a couple more questions in the meanwhile then. So someone is asking, are there any eligibility requirements to access service? And probably
I think I'm unmuted now, Angela. Good evening, everyone. I'm Michelle Lewis. I'm one of the clinical directors that is supporting the implementation of the mental health and addictions programming for the hub. And I think that question is a well-poised one, especially for our community. We know that there have been some poor outcomes when it comes to police involvement, especially around mental health, and the concerns that some families have around interacting. And so I think that having a guide for families to support individuals experiencing mental health concerns, to be able to get them the support that they need and feel safe in doing so, is one that we can certainly support. And this is why it's so important to have the community involvement. It's, the community, we want the community to play a very active role in developing the supports and services for the hub. And so it's nice to hear the concerns coming forward so that we can action them.
Thank you very much, Michelle. Thanks for that. And yes, we have some, we welcome those. We welcome those suggestions, right? And because they help us as part of a community. We said we're co-designing this. So you have suggestions for us, please send them forward, because we really want to hear from you. It's for you. So we want to hear from you what will work best for you. So the other question is, are there any eligibility requirements to access service? Who should take this one? Shane, you want to take it?
Let me pass it back to the frontline team who was answering, and then I'll put a caveat. So maybe Raquel and Janice and Lillian, in terms of this, because I think Janice sort of answered that earlier, but I wanted to put some pieces there, or Raquel, one of you.
Yeah, Raquel does, I think. Yes.
So
So actually, yeah, go ahead, Raquel, because I think you did mention about the free service.
Yes.
Yes.
The only caveat is that they need to identify as African, Caribbean, and Black. It doesn't matter their status in the country, doesn't matter their age, what the health issue is. We will address it and support it. We provide free health care. There are things that we don't cover, but the service, in terms of being seen by a doctor, nurse practitioner, or a diabetes team, the service is free.
Thank you.
And for the mental health and addiction teams, we are 16 and above, with the exception of our EPI team, which is 14 to 34. Other than that, our services are free and they're available, including our counselors.
Yes, Kadon?
Hi there. I would just also add that as we look around and see who needs services, we also try to prioritize folks who don't have another option. And so while all the services are free, there are some people who are within our communities that may have private insurance for some things like, physiotherapy. Well, if we're offering physiotherapy, we would prioritize those people who don't have access to private insurance, for example. There may be age ranges that go along with some services, where you may need to be an adult to access certain services, or 16 and up, or some services will be specifically designed for particular populations, maybe elders. And so you may be looking at a particular age for that as well. So it depends on the service. It depends on the care that's being offered, the very granular service delivery eligibility criteria. When we think of the hub writ large, the team is absolutely right. We're here to serve the entire community, prioritizing Black African Caribbean populations, and we'll do so with, with excellence in service delivery in mind. But we do know that there are going to be parameters for certain services, and they may differ across the different services.
Exactly what I wanted to mention about the caveat. That's what I think Kedon has explained thoroughly and comprehensively, that the requirements would differ based on the programmatic and service delivery areas. And I think Raquel mentioned it, the complementary of free services for members of the BAC community.
Okay, I know we're getting close to the time, so I'm going to say here, if we don't get to all of the questions, we are going to collect the questions and we will answer them and send them back out to those of you who we have on our lists. So just remember, if we don't get to all your questions, we will still correspond with you. But we have another one here around data collection. It says, we know that the Black Health and Social Services Hub, PEAL, will make a huge difference in the lives of the Black African and Caribbean communities, but others in the community and some politicians may not. Can we or will we collect data on the impact? And then the secondary question, are we partnering with TMU for research? So they want to know if are we collecting data so we can gather information on the impact of this, and then are we partnering with TMU? Kadon?
Sure. I'll get this quickly because I know we're running out of time. We are absolutely looking at data collection. We are looking at capturing our journey from the inception of this work, before there was any money attached to it, to the different parts of being funded, planning the services. We want to capture this journey so that we can have this shared with other organizations within Ontario, but across the country as well. We feel like we're building something amazing here to support the community, and we don't want to just hold on to that. We want to share it. And we're partnering with everyone who will support us to capture that information, keep track of it, document it, and to share it. TMU is absolutely a partner that's been eager to work on this together, and Dr. Trudy McFarlane, who is supporting their work there, especially with the establishment of the medical school in Peel. That is work that we are looking forward to working with them on. So thank you for that question, and a huge yes to that. We're also looking at research and how we can step into that space and make sure that our stories are being told by us as well. So I just wanted to jump in and say that.
Wonderful, thank you. So probably a couple more questions we can go. So someone said, when we speak about Mississauga's location, is Malton being thought about as a possible location? Who's going to take that one? Should I take it to Shane?
Yeah, as we know, I think, and Kedon and I and David, when we spoke earlier about the location and the challenges, we mentioned firstly, the hub is for the Peel region. And when we say Peel region, we're referring to serving the BAC community in Brampton, Mississauga, and in Caledon. And I hear the specifics around the particular location reference to Malton. And what we would like to say to you is that there are specific requirements that we are looking at in terms of space, size, location, access. And as we continue to sort of meander and to navigate that process, we continue to put the checklist against the particular location to ensure that we not only locate the various spokes and the main site in ways that is inaccessible. But what I wanted to say to you here, so that it doesn't sound like I'm beating around the bush, is that we are taking into consideration the location where the Black African Caribbean community is. And as you have heard, we're looking at the Mississauga piece, and we continue to expand, evolve, and to ensure that the services are accessible, readily available, and can meet the needs as to where the Black African Caribbean community is located within the entire region of Peel. And just to add that, the other piece is that even, for example, there isn't a hub, let's say in Malton per se. Remember, there is a mobile service that is coming. So we are able to take you where you're at. So just as you have the Uber and you have the other pieces, this will be the BAC mobile that will come directly into the area where the concentration of the Black African Caribbean community, because we want to make sure that it's barrier-free, it's inclusive, and it is accessible to the people that need it most.
Okay. So we are getting close. We are at 7:51, and I want to respect everybody's time. I'm going to probably go give one more question
Before you
before
go to
we
the
go to
question,
closing. But
Kadon
I
wants
see
to add
Kadon's
something.
hand. I was going to say, I see Kadon's hand is up. Go ahead, Kadon.
Sorry, I thought you were going to go to the one more question, Angela, and I wanted to just, there was one in there about, this is partly on the eligibility criteria, but also someone asked about if they're from an agency that is not a identified Black serving agency, if they can refer folks. And I think that is a really important question. I just wanted to touch on it briefly. We are here to serve and prioritize the health needs of Black African Caribbean populations, but we do know that we're a part of a larger community in Peel. And we know that as we try to recruit healthcare professionals, for example, not every single person is going to be from the Black African Caribbean community. We know that not 100% of our clients may be from the Black African Caribbean community. There may be a few, and I can't say that we have settled on any sort of metric there yet around measurement, but rest assured that our priority is going to be Black African Caribbean population. So if you have clients, regardless of the organization that you're with, if you've got clients who are from that community, please send them our way. And we would be happy to accept a warm referral or to share more information with your organization about the hub and how clients who are eligible may be able to access. But fitting the catchment of Peel, which is very broad, and being from the African Caribbean Black communities is the main criteria. And of course, there will be other instances where folks who may not necessarily be from the community are able to access care. So reach out, and we're happy to have conversations about that.
Wonderful. Thank you. We have some really great comments in here, a lot of congratulatory messages and thanks. But there's one here from one of our close partners who sent their congratulations, but they said, how can the rest of us who are not directly involved help you to reach your ultimate goal? So that is from one of our key partners. And I would say, continue being a key partner and ally, and continue doing what you've been doing all along, supporting and backing us up when we go to, especially go to the funders and talk. So continue doing that. We really appreciate your offer, and we know you are a strong ally with us. And there's something I just wanted to build off of. When Shane spoke about, we're going to have the hub, but we're having the spokes. And the spokes, because the hub is taking a long time to build out, we started with the spokes. So we are having the spokes in different areas. And who knows, we may have a spoke in Malton, depending on how we see things unfolding. But yes, we are doing the spokes as we build out the hub, which is going to be the larger, more the real integrated space when we get that one. So thank you for that, for your comments and for your questions and stuff. So we have 5 minutes to close in, and I know Shane wants to tell you before that, as we said, if there's any question in there that we did not answer, we will be collating all of this and sending it back out to the team. And I want to, so just know that we will answer. And please keep your questions coming. And Shane, I'm going to turn it to you now, because Shane is going to give the call to action and closing. So thank you, Shane.
Thank you very much, Angela. And I think it is important that we appreciate, we recognize, and we value that the Black Health and Social Services Hub is by the people, with the people, for the people. And as I mentioned this, I want to remind every person who is here and every person who will hear the message that your voice matters. And in reference to the question that was asked earlier, I would like to put a call to action that from then to now, I have two requests for you. One, you're asking how you can be a part, how you can support, how you can be able to move this thing along. We have a community advisory council. And I'm making a clarion call to you this evening. If you would like to be a part of the community advisory council, who are members, and if you're a member, sorry, of the Black African Caribbean community, and you're interested in the CAC, this is where you're going to provide advice, input, and support to the hub. There you go with your answer. You can ensure that the hub's programs and services are aligned with the needs, the priorities, and the aspirations of the Black African Caribbean community. You will also serve as a bridge to represent between the hub and the community, to foster, to collaborate, to ensure that there is transparency, authenticity, and inclusivity. And so this is an important part where your voice matters and where you can be in representation of the rest of the community. The next question you may ask, how do I do that? Application forms will be distributed next week. You fill them up, you send them in, and then the rest will take a natural course. It is so important that we look for persons who are willing, able, ready to serve, and to be a part of this exciting initiative, the CAC, Community Advisory Council. Did you hear me? Good. So let that sitting. And the second piece that I wanted to put a call to action for is that because we are doing this with you, by you, and for you, there will be several focus groups that will be held within the community starting in mid-October. This will be held both virtually and in person. So if you're unable to come out in person, you can come virtually. If you are interested in sharing your views and your thoughts, you can really do so by ensuring that you are part of this focus group to share in the vision, to share in the service delivery. We want to gather your thoughts, your ideas, your encouragement, whatever it is that you would like to say or to do or to be a part of this. I encourage you to contact us via email. It says your communication at bhsshubpeel.ca. You would also see in the chat, the website is there, www.bhsshubpeel.ca. You can also call the number 647-812-5226. So this is a call for two action items. One, a call to be a part of the Community Advisory Council. And secondly, a call to be a part of the focus group. I want to let you know that your advice and your support and all of that is important, and we want you to center that in the very essence of us building a very interactive, a very inclusive, and something for the Black African Caribbean community. So this is the two call to action this evening. I hope you have taken this down. 647-812-5226, www.bhsshubpeel.ca, and you can reach out and ask your question to us. Here you can see, you can follow us on Facebook, on Instagram, and on the Facebook and
LinkedIn.
LinkedIn. Sorry. So yes, I was going to say there. So Facebook, Instagram, and LinkedIn. There you have. You can take a quick picture of that page so you're able to share, you know, your thoughts, your ideas. You can reach out to us. You can everything that you think is maybe not so important. It is important. Share everything with us this evening. A call to action, and this, I believe, will result in many of you reaching out and asking for questions, clarifications, and just probably sharing your complimentary pieces. Thank you.
So thank you, everyone. This is the end of our town hall session, and we appreciate you. Thank you so much for coming on board. We look forward to seeing you at our various locations right now. And one of the things, I don't think we said it clearly, did we? That we do offer virtual sessions as well. So call our helpline, speak to our navigators, and they will help you to find the best service that's for you. So thank you again. Have a good night. God bless.